Hello, this is Dr. Randall Stafford. I'm a professor of medicine at Stanford University and the director of the Wellness Living Laboratory China Initiative. Well China is an important scientific study that will determine the relationship between lifestyle, chronic disease, wellness, and the environment. By looking at the interaction between these different forces, we will learn much about the causes of chronic disease and the things that we can do to promote wellness in populations. This study is much different than many other population studies, which typically look at disease outcomes, things like whether people develop cancer or have a heart attack. Instead, Well China is looking at wellness as the primary outcome. And by wellness, we mean the sense of quality of life or the sense of well-being that people have in their everyday lives. By looking upstream at wellness, we feel we can not only understand the development of chronic disease better, but we may also be able to better intervene, to change and to promote wellness in people who are at risk of developing chronic disease. The main goal of the study, therefore, is to really understand how wellness interacts with other features in terms of behavior and in terms of the environment in which people live. Chronic disease in China is a big problem. Over the last 30 years, China has gone through enormous transformation. Much of this transformation has improved the lives of the people of China, but it's also set in motion the conditions that have led to an epidemic of chronic disease. Nowhere else in the world has there been increases in rates of diabetes or heart disease as there are in China. So China is a location that we really need to understand, both for the sake of the public health of China, but the information from China may be very useful for other middle-income countries that are developing and may even be applicable to Western Europe and the United States. Well China will enroll 10,000 people and follow these individuals over time. We will enroll people from the city of Hangzhou. Hangzhou is a large urban area in the eastern seaboard of China, and it's a very famous city, both historically and because of its recent role as a high technology incubator within China. These 10,000 individuals will receive blood tests, physical measurement, and a survey questionnaire. The information from this study will not only help science, but we hope that it will help these individuals better understand their health and how to improve their level of wellness. This feedback to participants is also a way of keeping people involved in this study, because we really do want to study the development of chronic disease in this population long term. We are very happy to have an enormous range of partners involved in Well China. In particular, the Chronic Disease Research Institute of Zhejiang University is a key partner. Zhejiang University is one of the top research universities in China, and we are very happy to be collaborating with them. We also are collaborating with government health officials and with health centers within the city of Hangzhou to help with the data collection process and the process of enrolling individuals in this study. This study also is blessed by a really hardworking team of people, both here within Stanford Prevention Research Center and within the Chronic Disease Research Institute of Zhejiang University. The study of wellness in China adds to the overarching goals of the Wellness Living Laboratory, which will have populations not only in China, but also in California and Taiwan. The scientific importance of understanding wellness cannot be underestimated. Wellness is an important feature that often motivates people to change their lives and is an entry point for improving chronic disease outcomes before those chronic diseases begin to develop. Our long-term vision is to follow this population of 10,000 individuals for many, many years. We also will be studying interventions, things that we can do to improve wellness, promote improvements in people's lifestyles, and in some cases try to maintain high levels of wellness in the population. These interventions will give us a rigorous test of what works and what doesn't work in the area of improving wellness. The scientific information that we gain is relatively unique. There have been relatively few studies that have enrolled large populations and looked at wellness. So in conclusion, I'm very excited about the Well China initiative. By enrolling 10,000 people in this study and by following wellness and chronic disease measures over time, we'll make a very important contribution to advance scientific knowledge.